The management of Osun Health Insurance Agency, OSHIA, led by the Executive Secretary of the agency, Dr. Razak Akindele, converged on the conference room of the agency in a parley with members of the Fourth Estate of the realm to update the public about the giant strides of Governor Ademola Adeleke in the health sector through the Osun Health Insurance Scheme. Dr. Akindele described the accusations of poor funding leveled against the agency as false, saying that it has continued to grow from strength to strength as the number of enrollees have increased to 267,000, while 13,000 non-civil servants have registered, meaning that more people are beginning to appreciate the impact of government activities through OHIS.
Osun has one of the best primary healthcare systems in the country. The state government has committed a lot of resources in rehabilitating and upgrading the primary health centers in the state. 50 of such have just been completed.
The Executive Secretary also cleared the air on the issue of withdrawal of the services of OHIS from Onward Hospital and explained that the management of the private hospital voluntarily wrote a letter to officially request for the discontinuation of the scheme, citing rising inflationary trend in the country, adding that the agency is not owing the hospital any dime.
The withdrawal of Onward should not be publicized. They gave us a reason why they want to, and they also said in the letter that they will be willing to come back when things are more stable. You understand? So we don't see any reason why anybody should politicize hospital for that. And even beyond Onward, this year alone, we have received more than 20 applications from private hospitals that were not with us before that have shown interest in joining OHIS.
He appealed to all the enrollees in Onward Hospital to transfer their treatment to the nearest accredited hospitals for enrollment. Dr. Akindele similarly described as false the allegations that about 40 billion naira health grants from the federal government were misappropriated, noting that the agency has so far received a grant of 186 million naira from the federal government, and such grants are expended based on the directives of the providers.
Let it be known that the fund from federal government is meant for logistics of maintaining primary health care centers. Osun State has been receiving and still received second to the last amount in the state's funding from the federal government.
The Executive Secretary equally announced that OHIS has enrolled about 23,000 retirees free of charge, promising that the next set of people to benefit from the enrollment are those with disability, adding that the Ademola Adeleke administration remains committed towards improving the health condition of the people. Oluchi Amuda, OSBC News.